Hi, my name is Alec Martinez with Home and Rehab, and today we're going to talk about one of the common symptoms of stroke. This is called spasticity, or high tone. Now, spasticity is something that very commonly presents as something like a lack of flexibility. You'll notice that a lot of people with spasticity issues will seem to feel like they're caught in certain positions. Now, these positions can have a couple different things playing into them, but today we're going to talk about the very specific aspect of having difficulty reaching a full range of motion throughout that normal joint, even when passively moved. So what happens with spasticity is our spinal cord has taken over control of a muscle when the brain's having some difficulty communicating with it. Now, as we talked about in our first video, all of these symptoms come from an issue with the brain's communication with its output in this case. So, with stroke, when the brain cannot take over the primary function, some of our more primal reflexive things that occur just because of our nerves' communication with the spinal cord are going to take over. These reflexes involve stopping motions that they perceive as dangerous. So, in the case of someone who has high spasticity, if you move them slowly and gently through a range with light pressure, you might find that they have a lot greater range than if you try and quickly move them. You'll sometimes notice what's called a catch and release, a general increase in resistance, or if you try to move too quickly, a full rigidity wherein someone cannot move. Now, there are a lot of different ways to treat spasticity. There is, of course, some medical management, some injection management. There are even some surgical approaches that may be taken. However, in the early phases of physical therapy, one of the ways that we will commonly try to treat spasticity is very simply with gentle motion. So again, because we're trying to use light pressure, we're going to try and lay you down to keep gravity minimized so that you're not having to work against what we're doing. Then we will gently move you into a fully extended position at whatever joint we're trying to work with. And as slow as humanly possible, start rotating it on a long axis. So if you imagine my hand turning up and down, we're going to go as slow as possible to try and teach the nerves that they don't quite have to fear that end range motion. Now, the other thing we would try to incorporate that, if you have found you're stuck by spasticity, is try to encourage what's called volitional movement. And that is your ability to turn a muscle on and off on your own. Now, this is sometimes very difficult to do, and it'll involve a whole lot of work, and something we're going to address in our next video. So, if you do find that you do have some high spasticity, of course talk to your doctor and your neurologist to talk about what are some options for treatment. And then ask your physical therapist what are some exercises you can do to address some of the deficits you're finding from it. Have a great day.